Thank you, thank you. Good morning, everybody. Thank you so much for being here. It's a pleasure to be with everybody during the first week of the 2026 legislative session. I want to start off by thanking the Speaker for being here, and I know the Pro Temp is planning to be here in a minute. Thank you very much for your support generally and your support for this initiative. I also want to thank Senator Ginny Lyons, the chair of the Senate Health and Welfare Committee, for being here, and Representative Alyssa Black, the chair of the House Healthcare Committee, as well as the Vice Chair, Representative Daisy Berbecco, who are all the lead sponsors of the bill that we are here today to discuss. I also want to thank all of our other legislative colleagues who are joining us. We really appreciate your support. Thank you to Mike Fisher, Vermont's Chief Healthcare Advocate, and Stephanie Winters from the Vermont Medical Society for your leadership in strengthening Vermont's healthcare community. And last, I want to recognize Greg Marshaldon, the State Director of the AARP Vermont, for your tireless championing of Vermont's seniors and retirees. Thank you for being here with us. You will be hearing from most of these folks here in just a minute. You know, as lawmakers return to Montpelier, the work ahead for all of us comes down to a simple question. How do we make Vermont a place that we can afford? Today, I'm proud to stand with legislative leaders, with advocates, and with healthcare experts to offer a clear and practical answer to that question. A proposal that will lower prescription drug costs, improve access to care, and put money back in Vermonters' pockets. This proposal comes at a very urgent moment. Healthcare affordability subsidies have expired. Healthcare costs are rising, and more Vermonters are being forced to choose between paying for their prescription drugs and paying for other essentials like rent, groceries, and heating their homes. No one in America should be forced to make that choice, and yet prescription drugs remain shockingly high, and they keep climbing. Those costs don't hit patients just once. They ripple throughout our entire healthcare system, driving up premiums, straining family budgets, and worsening health outcomes. When people are forced to skip or ration their medication. So quite frankly, we need to do better here in Vermont. That's why we're here today to support H 577, which would give my office the authority to join Array RX, a multi-state partnership that combines the purchasing power of participating states to negotiate lower drug prices. By joining Array RX, every Vermonter, regardless of insurance status, would be able to access a free prescription drug discount card that can be used at most pharmacies nationwide. On average, this card saves users up to 80% on generic drugs and up to 20% on name brand drugs. It works for medications that treat chronic illness, mental health conditions, and everyday medical needs. And it delivers the savings right at the pharmacy counter. This is government at its best. Instead of each state going alone, states work together, giving us more power to reduce costs and deliver real savings to our residents. These kind of state partnerships are particularly important in this moment, in an era when the federal government is failing to deliver. And we know that this partnership works. In Connecticut, my counterpart, Comptroller Sean Scanlon, is already running this program. And card users in his state are saving about $200 per month on their prescription drug costs. Thousands of dollars of savings a year. Monies that families can use for groceries, for rent, for gas, or childcare, instead of handing it over to pharmaceutical companies. My office is excited about this proposal because it delivers on many of the highest priorities we have: reducing costs, working with other states to deliver more, and finding policies that will have a big impact without having a big price tag. Importantly, this program does not raise taxes, and there is no ongoing cost to the state of Vermont, and the savings flow directly to patients at the pharmacy counter. For too long, Vermonters have been at the mercy of the pharmaceutical companies whose greed seems to know no bounds. High drug prices are one of the biggest drivers of Vermont's health care premiums today. Today, Vermonters spend about $1 for every $5 that they earn on health care. And rising health care costs are one of the biggest drivers of school spending and property tax increases. This is a defining challenge for Vermont, so it is going to continue to be a critical focus of our office. Last year, we worked with the legislature on a proposal to eliminate up to $100 million of medical debt. Because of that work, 60,000 Vermonters are expected to receive life-changing debt forgiveness in the coming years. Now we're proud to put forward a proposal that, in time, will collectively save Vermonters millions of dollars on their health care costs. Joining Array RX won't solve everything that's wrong with health care here in Vermont, but it is another meaningful step, and it's another immediate step toward reining in costs and toward creating a system that works for people instead of against them. Finally, to those Vermonters across our state, if prescription drug costs are affecting you or are affecting your families, now is the time to speak up. I encourage you to contact your legislators and encourage them to support H577. And to the lawmakers that are here with us and in the building, our office stands ready to work with you to move this proposal forward this session to deliver real savings for Vermonters. It is certainly an important step, but it also won't be the last step. The Treasurer's Office will continue to bring forward bold, practical solutions that continue to make Vermont a place we can all afford. Thank you so much for being here today. We'll now hear from the Speaker of the House, Jill Kerwinsky. Speaker?
Thank you. Thank you very much.
Thank you.
Thank you. Thank you so much to the Treasurer and to his team for bringing forward this initiative to help Vermonters afford prescription drugs that they need and deserve. The Trump administration has made it clear that they have no intention of working on health care. In fact, they've gone in the complete opposite direction with decisions to end policies limiting prescription drug costs for those on Medicaid and Medicare and supporting the end of health care subsidies. Fortunately, though, the legislature, healthcare organizations, and state offices like the Treasurer are working together to find creative ways that we can find to lower costs for Vermonters. In last session, we worked hard to reduce the cost of our healthcare system. We passed legislation bringing down the cost of drugs, directing hospitals to find over $100 million in cost reductions. This resulted in a decrease in the teachers' health insurance, bringing the total increase to single digits for the first time in several years. We will continue to do everything we can to identify real solutions to the healthcare cost crisis facing our state, but we can't do it alone. I really want to thank the Treasurer and his office for the work they did this summer to find a new health insurer for our retired teachers. The retired teacher plan was facing a whopping 50% renewal increase, which would have resulted in costs skyrocketing for retirees and tens of millions of dollars in costs and increases to taxpayers. They found an alternative that significantly lowered costs and rate increase caps for future years, providing peace of mind for our retired teachers and savings for taxpayers. And that is what it's going to take to make real change in reducing the cost of health care for Vermonters. A multi-pronged approach with collaboration between the legislature and state leaders like the Treasurer. By joining Array RX, we are taking another step in providing real savings to Vermonters for the prescription medications that they need for chronic conditions, mental health needs, and acute medical emergencies. There are not one single fix to the healthcare affordability crisis before us, but steps like this, taking steps like this, will lead to meaningful change for our state. Thank you.
Thank you very much, Madam Speaker, and I really appreciate you being here and your support. And now we'll hear from Chair Senator Ginny Lyons.
Oh, thank you.
Thank you all. Thank you, Treasurer Pieciak. He's taller than I am. It's really great to be here today to celebrate the bill that is in the House Healthcare Committee. We have a companion bill in our committee. I'd like to introduce my vice chair, Senator Martine Larocque-Gulick, who is working with me in our committee, and we look forward to having the House complete work on H577 and sending it to us so we can get it out quickly. The prescription drugs are just unbelievably high priced, forcing Vermonters to skip buying their medication or rationing their medication, and unfortunately making choices about food, heat, housing, and health. We can't have this continue. We began work in many ways last year in a number of areas, but prescription drugs being such a key high amount of payment that folks make in order to survive. And unfortunately, the regulation of prescription drugs doesn't happen. It is left to us to make decisions about how best to lower costs on these very essential healthcare, say more. The great thing about this program, about ArrayRx, is it's no cost to taxpayers and allows for real savings, putting money back into pockets, as I said before, that will allow for folks to spend on other essentials in their lives. This is a call to action. I know the treasurer has said, please reach out to your legislators. Unfortunately, the people who have chronic illnesses or are trying to find these life-saving drugs are not the same folks who can reach out to us. They don't have the time or the energy. So I ask all of you who do have the time and the energy to please reach out to us and support this bill. It is critically important. Finally, I really want to recognize the leadership that Treasurer Pieciak is taking, not just for bringing this free drug program to the state of Vermont, but working so well and collaboratively with other states. This is a first step that we can take in having regional health care work together. So, and I really recognize the leadership that Mike Pieciak has demonstrated in this area. So thank you all for being here, and I will turn it over to Representative Alyssa Black.
I'm a little taller than Senator Lyons, but not as tall as Treasurer Pieciak. I'm Representative Alyssa Black. I chair House Healthcare, and I also want to recognize my ranking member, Daisy Berbecco. We are the two co-lead sponsors on H577. Prescription drug prices are outrageous, and high drug prices are driving up healthcare costs for all of us and making it harder for Vermonters to afford the medications that they need for their chronic conditions, mental health, and just their everyday care. Our committee hears from these Vermonters on a daily basis, and we're always looking for immediate, no-cost solutions that make healthcare in Vermont more affordable and accessible. Additionally, coverage gaps are widening. As the ACA subsidies expire, more Vermonters risk losing their insurance and paying fully out of pocket for prescriptions, increasing financial hardship, stress, and health risks. This plan offers a proven and immediate solution at no ongoing cost to taxpayers. By joining ArrayRx, Vermont can partner with states to hold the drug companies accountable, negotiate lower prices, and secure a drug discount for Vermonters, regardless of their coverage. In states like Connecticut, residents have saved hundreds per prescription. The House Health Care Committee looks forward to discussing this bill, H577, and earning the support of all the members and moving it forward to become law. And I urge legislative colleagues to explore the Treasurer's proposal and connect with his staff if they have any questions. And I also invite Vermonters to contact their legislators in favor of this important step towards lowering drug costs and strengthening our healthcare system and ensuring that all Vermonters can afford the medications that they need. And I think I'm going to turn it over to our healthcare advocate, Mr. Fisher.
Thank you.
Thank you. Good to be here. I'm Mike Fisher. I'm the Chief Healthcare Advocate. I'm proud to be here in support of this initiative, and I really want to appreciate and thank the Treasurer's Office and legislative leaders for working on healthcare affordability. We hear from Vermonters regularly who call us in desperation, how am I going to keep myself healthy? How am I going to follow my doctor's advice when there are economic pressures that interfere? We want people to make healthcare choices, not economic choices. Unfortunately, sometimes they have no choice. Prescription drug prices, Alyssa said it well, Representative Black said it well, prescription drug prices are outrageous. We see cases where people are often paying 20 times or more the cost of what it actually takes to manufacture the drug. We believe this is unconscionable. Vermonters can't afford to pay more for prescription drugs. Vermont law is already clear. It says that Vermonters should pay no more than their medications than the best available price. What the Vermont Prescription Drug Discount Card Program would do is unlock a better price for Vermonters. Vermonters will benefit from this better price, including by having these expenses applied to their cost-sharing requirements if they have insurance. At the HCA, we're always looking for ways to reduce costs for Vermonters. The Vermont Prescription Drug Discount Program would be another tool, another important tool in helping reduce costs for Vermonters. Appreciate the effort and happy to stand here in support.
Well, thank you very much, Mike. And now we'll hear from Stephanie Winters, Vermont Medical Society Deputy Director.
Thank you, Treasurer Pieciak and legislative leaders, for continuing to look for ways to reduce patients' out-of-pocket costs and healthcare costs to obtain essential healthcare services. I'm Stephanie Winters. I'm the Deputy Director of the Vermont Medical Society. We are a Vermont's statewide physician and physician assistant membership association. In 2024 alone, Americans spent an estimated $98 billion in out-of-pocket prescription drug costs. That's an increase of 25% over the past 5 years. Here in Vermont, these national trends have real consequences. We hear from our members that their patients are regularly delaying, skipping medications because of costs, or rationing. And that worsens chronic disease and increases preventable emergency visits and hospitalizations. As stated previously, with the loss of the federal subsidies, thousands of Vermonters may be losing coverage and having to pay the full cost of their prescriptions out of pocket. The Treasurer's proposal to partner with Array RX offers a way to lower prescription drug costs at no cost to taxpayers, while delivering meaningful savings for seniors, families, and Vermonters who rely on medications in order to work, care for their families, and live a healthy life. We support this program wholeheartedly, and we hope that legislative leaders and other legislators will also support this as a way to reduce out-of-pocket costs to improve medication availability and health outcomes for all. Thank you.
Thank you. And last but not least, we will hear from Greg Marshaldon, the State Director of the AARP Vermont. Thanks for being Greg.
I just want to be a real quick cheerleader for bulk purchasing. Everybody knows that going to Costco and purchasing paper towels that way, as opposed to going to a small store and purchasing paper towels that way, provides real discounts to real people who really need them. And this bulk purchasing program the state treasurer is smartly trying to get us involved in. It's going to make a lot of sense. And the other thing, too, is that any savings that bulk purchasing may also have an effect on the state budget and other pieces because it's going to lower costs all the way around. I'd like to say that seniors are hit particularly hard by the cost of prescription drugs. We are particularly concerned about our members between 50 and 64 years old who are really, really getting squeezed here. We hear from them all the time. This and the cost of fuel and heating are the two things that we are hearing most from them right now. I would have to say that what we hear from them about prescription drugs dates back a year, 5 years, 10 years, 20 years. This is not news to us. But as we're seeing the stuff going on now with the ACA and the squeeze and the subsidies, it is particularly important for that gap group there who are going to end up paying exorbitant prices for the cost of prescription drugs they need to remain healthy and active parts of the Vermont society. Finally, I'd just like to say that we're proud to support this proposal. We're going to work closely with the State Treasurer's Office, the chairs of the committee, and anybody else, and we intend to make our members aware of this legislation, encourage them to contact their legislators, and when it's passed, we're going to be a part of letting people know that this program is available to them. So thanks for having me today.
Well, thank you, everybody. We happy to take some questions if folks have them.
You're working through some sort of PBM, right?
Yeah, so ArrayRx is administered by the state of Oregon, and the state of Oregon has partnerships, relationships, contracts with their own PBM.
Some PBMs have a bad reputation. Can you explain why this one is different?
Yeah, well, I think the big thing about this program is that it's state-run, state-owned. There's no profit motive here for any of the states. It's for the public good, so they can pass along the savings that are achieved directly to consumers. They don't sell the data that they collect from customers either, which is not always the case with other discount card programs. And they also work with the pharmacies. They don't want the pharmacies to go out of business, particularly the independent and rural pharmacies. So they have better reimbursement rates than other discount card carriers. So I think the big difference is the public good and the lack of a profit incentive.
Right. Is the PBM publicly owned, or is it just right, like a vendor that is regulated? Or
Yeah, so it's not the state of Oregon PBM, but it does have the contract with the state of Oregon and ArrayRx. Yeah.
The states that are participating right now, Oregon, Washington, and Connecticut?
Oregon, Washington, Connecticut, Arizona, and Wisconsin. So there are other New England states that we've heard of that are interested in participating, but thanks to the legislature, we're at the front of the line for other New England states in terms of joining the partnership because we're active.
I read that Connecticut was a little disappointed with the uptake. The usage of the program has been in effect, I think, since 2023, but there's only like 20,000 people.
Yeah, I think 20 or 25,000.
What do you make of that, and how do you think Vermont's rate of usage would differ or would be if it were implemented?
So when I talked to the comptroller, Sean Scanlon, he said that he's actually quite excited about their uptake, that they've been able to get to the point that they're at more quickly than the other states that have joined the partnership. Of course, 25,000 against the millions that live in Connecticut, they want more people to participate in this. It's why we're asking for a small one-time appropriation to help spread the word, a $50,000 appropriation, because I think it all does boil down to how much effort you put in, how much awareness there is around the card so that people know that it exists and they participate with it, because there's no cost. It's easy to download. You can have it on your phone. There's all the incentives in the world to do it, but you have to know about it. And I think that's another reason why it's great to have a state agency that's going to be in charge of it, because we have the capacity and the ability to help spread that word. And hopefully we have the trust as well when we go out and talk about this card that is a state program that Vermonters can participate in.
Do the other states also, does this program in other states also live and is it administered by the treasurer's office in those states? Is that a common setup?
So the comptroller's, an equivalent to the treasurer's office, and they run that program in Connecticut. In the other states, it's a variety. Oftentimes, it's somebody within their AHS or something like that. But certainly, we think we're very much a good partner for this discount card program.
Is the treasurer's office the one being the point on this because the governor has not expressed an interest or willingness to support such a program?
Well, certainly when we see issues that we think are critical to address, I'm going to address them, the legislature is going to address them. When I went around this fall, actually in connection with the Vermont Saves tour that we did, we actually heard from a lot of individuals. Well, first of all, we heard from a lot of businesses that said, thank you for having this retirement program. Now can you do healthcare? Because that's the thing that's really harming us. And then we also heard from individuals. They weren't even part of the tour. We just were meeting with them while we were at a diner at a restaurant. And they said, I just got my premium. My ACA subsidy is going to go up $1,000. It's going to go up $2,000. They're at an age where they need health care. They need health insurance. But they were telling me, I think I'm just going to go without it. So I hear from Vermonters that this is a big issue, and that's why we're stepping up to try to address it.
Is the 20 to 80% range of savings for people who have no insurance and have to pay full boat retail for their drugs, or is that savings compared to the bad insurance program that they currently have?
So that, folks that use a discount card, they're eligible whether they have insurance or whether they don't have insurance, and they get the same discount and the same benefit. So it applies to everybody. If you have insurance, you may want to look at, what kind of rate do I have through my insurance? Is it less expensive? I think people will find, for the most part, that the discount drug card actually is less expensive than a lot of the traditional insurance options. And unfortunately, the people that will benefit it from the most certainly are those that don't have insurance at all. They just don't have any other options. Or maybe they're on Medicare, but they don't have a Part D. They don't have a prescription plan. So those are the folks that will benefit the most because they just get the discount. There's no sort of cost shopping or a comparison about what options they should do. They just are simply getting that cost savings.
Thank you.
When those cards are, rephrase that. When those cards do come through and people are able to apply for them, how they go about receiving this?
Yeah, so there can be a physical card, but there's also can be a downloaded card on your phone. So people would just sign up through a website, put in their information, they get verified that they have a connection to Vermont. That means both that they live here, but also it could mean that they work here. And in other states, they've talked about folks that have visited, family or friends that have visited from other nations, other countries, and they're staying for a few weeks, and they had a medical issue and they needed prescription drugs, and they put in the family that they're staying with and their address, and they were able to access the card and get it immediately and use the program immediately. So it really is broad in terms of who it impacts, and it'll be easy to sign up for and get that information.
Is there likely to be an income threshold for this program, or anyone wide open?
Anybody. So it applies to anybody regardless. The savings are felt across the board.
So you say everybody is eligible to use these cards, or that these cards may be even more beneficial to use than insurance. This isn't something that they can stack on top of. If you have insurance, can you also use the card, or do you have to use the card or your insurance when getting your prescriptions?
So it was a conversation the healthcare advocate and I were having right before the press conference. In other states, they have to choose between the card and the insurance. And if they use the card, it doesn't count toward their deductible. Connecticut is passing legislation or working on legislation that would have the discount apply to their deductible, even if they use the discount card. And there's some question about whether that's already the case here in Vermont that I think we're going to have to continue to work through and sort out.
Question. Have you coordinated or been in communication with the independent pharmacies and pharmacists in Vermont, and what are you hearing from them about this program?
Yeah, we've worked with independent pharmacies, retail pharmacies. We want to make sure we engage with all stakeholders. So, we have heard, one of the things about the Array RX versus other discount cards is what I was mentioning to Lola. Like, they don't want to undercut the pharmacist to such a point that they're losing money on the transaction, because obviously if that happens over and over, then that independent pharmacist is going to go out of business. And maybe the only pharmacist in a particular community is no longer going to be available. So from our perspective, our point is that this is a better program, and I think that message was heard.
You had mentioned early on this is also a matter of states working together.
Yeah.
Can you break down a little bit about what those relationships are like and what the benefits or potential downsides are to that?
Yeah, well, I really think it's only benefits. I really don't see any downsides. I mean, in this example, Oregon and Washington have created this collaborative that now other states are joining. The state of New York is also joining this collaborative, not for the pharmacy discount card and not for some of the other programs that they offer, but simply because they want to be in conversation with these other states about what are they doing in the area of healthcare so that they can import some of those ideas back to New York State. So those are just the examples of that kind of collaboration and information sharing the best ideas, understanding what's working. You know, we did this with our Vermont Saves program as well. We passed it here in the legislature, but when we went to set it up and operationalize it, we partnered with the state of Colorado. It's the only way we could have set it up in Vermont because we're so small. And doing it through Colorado meant we did it faster and we did it with less expense. So we were able to provide a benefit to Vermonters because we leveraged the size of other states working collectively.
I just want to go back to a question that was asked about, you know, whether or not you can stack it on top of insurance. So it sounds like you guys that is the intent, but you're not sure whether or not you need to amend the bill. I guess.
Yeah, so we were going forward with the understanding that even if you couldn't stack it, this was still a beneficial program because, you know, if you're somebody that doesn't have insurance, there's really no decision to be made. If you're somebody that's really underinsured and you're late in the year, or you're generally a young, healthy person that doesn't have a lot of healthcare expenses, it's kind of like a no-brainer as well. And then there's also certain drugs that aren't covered by your insurance where it's a no-brainer. A lot of the weight loss drugs that are not being covered by insurance are eligible for this discount card. They're about 40% savings. So the state of Connecticut mentioned that's one of their largest uptakes in their state. So I think there's a variety of ways this is beneficial to somebody, even if they can't stack it. But if they can, then it is even better. But that part of it, we just have to do a little bit more due diligence on about what the current status of Vermont law is.
And would the intent be that if Vermont law, that you would include in this bill something that would allow that to happen? Or is it possible that that might not be possible?
It might not be possible immediately, but I think over time, it's certainly the direction that you'd want to go with a program like this.
With your partnership with RayRx, I think you said, correct me if I'm wrong, they will negotiate prices of prescription drugs. Do you know like how those negotiations will work and how they decide which drug is going to be priced at what price and so forth?
Yeah, well, they've been engaged in this for a number of years, so you know they probably have multiple year contracts, and those contracts renew. But they've done a lot of the heavy lifting by just setting it up in the first instance. So you know that was something that was done when we weren't part of the partnership. But you know those negotiations and those bulk purchasing and that commitment to purchase through that network is the thing that really brings value to those pharmacies. So they're bringing something that's very beneficial, very powerful, and then getting that discount in exchange for it.
And you had mentioned this has been the case before where people have family that come in from out of the country and perhaps have a medical emergency, need to get assistance when paying for these prescription drugs. I just imagine this will be a concern that comes up for some folks. Are there concerns about potential exploitation of this program?
Well, you know, it doesn't add any cost to the state of Vermont. It doesn't add any cost to the program to utilize the card. The discount is there for anybody that's eligible. And basically, you just have to have a Vermont address to be eligible. So it's really not bending the system in any way. It's just simply taking advantage of a program that's available.
I know you touched a little bit on which drugs would be priced at, or which drugs would be cheaper and which ones would like the discount. One was 20%, 50%. But can you kind of tell me a little bit about which drugs would fall into those categories?
Yeah, for sure. So the 80% discount will apply to the generic drugs, so drugs that have run out of their patent, right? And there might be multiple of them that are available. The 20% or up to 20% sort of applies more to the name brand drugs, the drugs that are still under their patent, and there's just basically one option available. So the discount's deeper for those generic drugs because there's more competition, there's more opportunity, and generally there's more opportunity to negotiate once, you know, the patent has run. Well, thank you, everybody. Happy to stick around if you have additional questions, but want to thank again our speakers and our legislators for being here, and thank you all for being here as well. Thanks, everybody.
Thank you.